Hi, my name is Caleb Jarosh. I'm a licensed acupuncturist. I'm going to talk to you about fatty liver disease, specifically non-alcoholic fatty liver disease. So what exactly is it? So non-alcoholic fatty liver disease, it's a term used for a wide range of liver conditions that can affect people who drink very little or no alcohol. So fatty liver can also occur from excess alcohol consumption, obviously, but here we're concentrating on this phenomenon where people don't drink and they get the same thing. So it occurs when there's an excess buildup of fat in the liver. Okay, so this is known as steatosis. And once the fat exceeds 5 to 10% of the liver's weight, the liver is considered to be a fatty liver. And so what this does is it impedes the liver from actually being able to operate and function normally. So the uptake of fatty acids is greater than the amount that can actually get cleared from the liver. And this causes a really, really huge problem. And I see it a lot in a lot of my patients. So the liver inflammation, it's characteristic of this kind of problem. And one or more of the advanced forms of the disease, and it can eventually lead to scarring, just like cirrhosis from alcoholism. So the damage in the liver, it's pretty much the same as heavy alcohol use, except the people aren't drinking. So some of the causes to this are consuming excess carbohydrates. And the excess carbohydrates end up plugging up the liver. This is found in cardiovascular disease, type 2 diabetes. It's really a problem. It can also include the following different risk factors. So typically it comes with the midsection fat accumulation. You'll get high triglyceride levels in your labs, low HDL reading, cholesterol levels, usually high blood pressure, and your blood sugar levels are also going to be elevated. But what I want to do now is I actually want to share how Chinese herbs are really powerful for treating this. And this was a study that used eugen or turmeric or curcumin. And it was in a medicinal concentration. But these have been used for thousands of years. I use them in my clinic and they work very, very well. And this is an impressive study because it had a huge benefit and improvement of the fatty liver. So I'll just share it with you. So it's anti-inflammatory in nature. It's an antioxidant. So in the study, it was a randomized, double-blind, placebo-controlled trial. It took patients suffering from non-alcoholic fatty liver disease, and it broke them into two groups. So one group took 700 milligrams of the turmeric once daily for 8 weeks, while the other group took a placebo. And they did multiple measures that were taken, baselines, and then they followed, at the end of the 8 weeks of treatment, what they found was remarkable. That the group that had been taking the turmeric experienced a significant reduction in the liver fat content when compared to the placebo group. Imagine that. So on average, the turmeric participants, or curcumin, experienced a 78.9% improvement in liver fat content. Additionally, other significant reductions, as you might guess, that occurred in the body were the total cholesterol levels, the LDL cholesterol, the triglycerides, and the blood glucose when compared to the placebo group were quite different. So I see this condition a lot. It's very, very common because of what I said before. Diet can contribute to this, specifically eating very, very high carb diets. This can also happen when people are going through weight loss using ketosis, and I've done another video on that, and you can look at that. But it can also happen in that situation as well. So the important thing about this is that if you do have fatty liver disease, you really want to deal with it, because long-term what it will do is will plug up the liver with the fat, and the cells will stop working correctly, and it will develop long-term into scarring or cirrhosis of the liver. And this is very, very difficult to detect in lab tests because the liver is an amazing organ that only needs 20% to really do its job. So it can be quite diseased and you might not even know it. It might not even show up in your lab tests. So it's essential that you use those other markers that I mentioned to really diagnose whether you have fatty liver disease. You can also come to a practitioner like me that does pulse diagnosis, and it will show up as well in the pulse. So let's talk a little bit about how to actually treat this. Well, first of all, the most obvious is, yes, reduce your carbohydrate load and increase your protein and your fat intake in place of the carbohydrates. Now, the second thing that's really, really important is that you increase your vegetable intake, specifically hardy green, leafy green vegetables like kale, chard, and cruciferous vegetables. The third thing you can do is you can actually take a B vitamin called choline, and that will help as well. And the fourth thing that you can do is you can also take turmeric, but it's going to be helpful if it's actually in a concentrated form. So the kind of herbs that I use are in concentrated forms, so they actually become a medicinal form of the compounds, and they're in high enough concentration they can treat these different diseases. Hi, my name is Caleb Girosh. I'm a licensed acupuncturist. Thanks so much for joining me. And please remember, if you're interested and you like this and you want more, please subscribe.